Welcome back to NTV News First Edition. February is Psychology Month in Canada. And did you know there are approximately 18,000 psychologists across the country, and just over 200 of those practice right here in Newfoundland and Labrador, including Dr. Janine Hubbard, who joins me live now. Happy Psychology Month.
And happy Psychology Month to you and our listening audience.
So what is a psychologist?
Really good question that surprisingly is often very confused. So a psychologist is someone who received undergraduate and then graduate training, typically master's degree and or doctorate training in psychology. Means they spent somewhere between 6 to 12 years in university and then completed some licensing exams and some supervised practice. It's a restricted title, which means we are accountable to a licensing board and can be reported by the public if they feel we've been acting inappropriately and violating we have a code of ethics. And it means that we're required to do things like keep up on continuing education and a number of things to keep us on top of our game and providing the best possible services within the psychological field.
Okay, you are a clinical child psychologist, so what does that mean?
What that means is, in my case, my specialization during my graduate training was specifically working with kids and children. So understanding things like neurodevelopmental disorders, understanding general child development, because if you don't know what a typically developing child looks like, how are you going to be able to identify one who's perhaps exhibiting behaviors that aren't on that typical range? And psychologists come in all stages and forms, and clinical or counseling or school psychology are some of the most common ones, but we also have lots of psychologists who teach. We have a whole field called industrial organizational psychology, where they go in and might be able to help with organizations or looking at mental health and wellness within an organization. It can be right down to how are physical rooms and spaces designed. Psychology often consults with things like works in forensics or consults with police forces or military, does things like pre-employment screening. It's probably one of the reasons I like the field so much is because it is so varied and there are so many opportunities.
Now, I'm not quite sure how much time we have left. Probably not a lot of time, about 1 minute. So we're not going to get this in. Maybe we can finish it next week. But how are psychologists different than other mental health providers?
Really good question. And I forgot research in the last segment, and that's a huge population, and yes. I have colleagues who would be very upset with me. So psychiatrists go through graduate training as well, but they go through medical training. So they attend medical school and then they do specialized advanced training within the field of psychiatry. Believe it or not, it's actually both equivalent in terms of the number of years of training. Mm-hmm. The simplest difference is psychiatrists are able to prescribe medication where psychologists do not. Psychiatrists often focus on diagnosis and, again, figuring out a medication piece of things. They may do some therapy. Psychologists, we don't do the medication, but we certainly focus on assessment and diagnosis. We tend to use things like assessment tools to assess for, say, learning disabilities, or looking at neuropsychological functioning, say, after you've had a brain injury, or helping someone return to work and figuring out what kind of vocational assessment will help figure out what kind of job is best suited for them. So in a nutshell, those are the two big ones. Counselors are also an integral part. All of these should work as a puzzle. We're complementing each other, but not duplicating each other. So we also have counselors that are part of the picture as well.
I'm sorry to cut you off, but we are completely out of time. We will finish this conversation, or at least talk about it some more next week. Thank you so much for coming in.
Sounds great. Thanks, Tony.
And this is